Take it forward, please, excuse me. We begin with the frontal bone. As you know, is here, not a problem. The frontal bone is here. Now remember, the surface markings are indented and located below the name of the bone. So the supraorbital foramen, unfortunately in the plastic models, we can't see them, but they would be a little opening above each orbit. Right, supraorbital foramen. Now, with the authentic skull that Mr. Ryan has, you could see both supraorbital foramina, which is the plural form. Parietal bones, not a problem. These two bones here, right? You could see them easily, the parietal bones. Now, isn't it true that there are two sutures associated with both of those bones? The sagittal suture, which connects the two parietal bones, the coronal suture, which connects the parietal bone to the frontal bones. Are you okay? Now, these are all surface markings, and whenever we talk about joints, we'll talk about sutures. A joint in general, this is an aside, a joint in general is a point of connection between two bones. Some joints are movable, some are immovable, and some are slightly movable. The sutures are immovable joints, you know? Another name for a joint is an articulation. Can you imagine if it moved? Okay. So for the practical, which will be given on the 20th, please recall, I could put a pin here and ask you to identify the surface marking. And you would just identify it easily as the sagittal suture, right? Or I could put a piece of tape here and ask you to identify the bone. Okay? I'd like to move on to temporal bones. There are two of them, one on either side. Here's the temporal bone here, not a problem, right? The temporal bone. We have several bone markings associated with the temporal bone. We have the squamosal suture. Now with the plastic models, it's very difficult to see the squamosal suture, but you can kind of see like a squiggly line here and there. I probably wouldn't use this. I would probably use what Mr. Ryan has. In fact, he's looking at it right now. Do you see that really detailed line right there? That's the squamosal suture without hesitation, right? Now, I could use any model for the external auditory, also known as external acoustic meatus. I could use any skull for that, right? It's that canal. External auditory meatus, also known as the external acoustic meatus. You can call it either. It doesn't matter. Now we have the styloid process. There are several styloid processes associated with the skeleton. The one associated with the skull is this really tiny, narrow, pointed, somewhat pointed process. We call the styloid process. You see it? Styloid process. Styloid process. Then we come to the mastoid process. I skipped one, but if you don't mind, may I go to the mastoid process? It's right here. Can you see how it's inferior and posterior to the ear? You can actually palpate it here. Okay, this is the mastoid process. Massive, I think of when I think of mastoid process. Can you see its location relative to the styloid process? Relative to the styloid process. Now we come to the zygomatic process. Remember this ridge right here of bone is called the zygomatic arch, but it can be divided into two parts, okay? This part of the arch is called the zygomatic process. It's called the zygomatic process. It's a part of the temporal bone. Now this process grows during development in the direction of the zygomatic bone, okay? But at the same time, there's a part of the zygomatic bone that grows toward the temporal bone, and that's called the temporal process. So if I have the piece of tape here with a pin, you should say that, you should say that this is the temporal process. Do you see temporal process? This is the temporal process of the zygomatic bone. See, the zygomatic bone is here. This is the zygomatic bone right here. However, one of its markings is actually a continuum of the actual bone itself, called the temporal process of the zygomatic bone. Are you okay?
Mm-hmm. They have it labeled as zygomatic process or the temporal bone.
Yeah, if we move further away or downstream and I place the pointer here closer to the temporal bone, this will be comparable to the zygomatic process of the temporal bone. Good assessment. Are you okay? I'd like to move on. Mandibular fossa. This is the lower jaw right here. This is the lower jaw here. We call this the mandible. This is called the mandible. But this is called the maxilla. This is the upper portion, okay? But we call this not the jaw, we call it the lower jaw, the mandible. Now, the mandible fits into a part of the temporal bone. It forms a joint with the temporal bone by way of a groove called the mandibular fossa. There's one on each side. It's called the mandibular fossa. A fossa is usually a groove. And usually a bone, a part of a bone will fit into a fossa, usually. So the mandibular fossa, located on the temporal bone, is the site where the mandible attaches to that bone. Mandibular fossa. Now let's go back in your mind's eye. Can you see the frontal bone? Can you see the supraorbital foramen, even though we can't see them on plastic models? Can you see the parietal bones? Can you see the sagittal suture? Can you see the coronal suture? Okay, great. Let's go to the temporal bone. Can you see the squamous suture? You can see it well with Mr. Ryan's model. Can you see the external auditory meatus, also known as the external acoustic meatus? Can you see the styloid process, this little thin process here? Can you see the mastoid process? Can you see the zygomatic process of the temporal bone? Now we come to the mandibular fossa. Remember, the mandibular fossa is a little groove along the temporal bone. Now we come to the stylomastoid foramen. Now you know where the styloid process is, right? And the mastoid process. There's a little hole in there, right between the two. This opening is called the stylomastoid foramen. It's called the stylomastoid foramen. Stylomastoid foramen. It's a hole. A foramen is a hole. It's a hole between the styloid process and the mastoid process. Stylomastoid foramen. I urge you, if you have time, to read the literature in your lab manual that describes what these particular surface markings facilitate. What kind of vessels pass through them. I'm not going to ask you about that, but that gives you a better picture. We just don't have time to do that, unfortunately. No, because as you cover certain topics in 231 and 232, these particular surface markings will be brought up in your lecture. We may say, okay, this blood vessel passes through the stylomastoid foramen. You won't be tested on that, but it'll be understood that you know where that's located, okay? Now we come to the jugular and the carotid canal. You can also call it carotid foramen. Now, the jugular foramen is this very large opening right next to the styloid process. Do you see it? It's called the jugular foramen. Usually the jugular foramen, the stylomastoid foramen, and the carotid canal are all clustered together. They're all clustered in one area. Can you see the stylomastoid foramen relative to the jugular foramen? Mr. Can you please give me another pointer that in that beaker? Thank you very much. Okay. Here I have this second pointer on the stylomastoid foramen, just to give you some perspective as to the location of the stylomastoid foramen relative to the jugular foramen. Can you see that? The jugular foramen is very close to the stylomastoid foramen. The jugular foramen and the stylomastoid foramen are very close. Whenever you're referring to more than one foramen, the plural form is foramina. The plural form is foramina. Please, Mr. Now we come to the carotid canal. The carotid canal. Last request, I just said you may have them, please. I should have asked you for two. The carotid canal is located above, in this position, above the jugular foramen. I have my finger on a pointer that is pointing in the carotid canal. The carotid canal. Carotid artery passes through the carotid canal. Jugular vein passes through the jugular foramen. So this is the carotid canal. You can call it carotid foramen. Can you see how they're all clustered together? The jugular foramen, stylomastoid foramen, and carotid canal. Carotid canal here. Jugular foramen, stylomastoid foramen. Are you okay? Do you have any questions for clarity? I'd like to move on to the occipital bone. The occipital bone has 4 surface markings that you should familiarize yourself. One would be the lambdoid suture, and you can't really see it well unless the cap of the skull is connected, or you could just look at the cap of the skull. Can you see this? This is the lambdoid suture, because it looks like the Greek letter lambda. Lambdoid suture, if you really look at it. Lambdoid suture. So when we say that the lambdoid suture connects the occipital bones to the parietal bones. Lambdoid suture. So the lambdoid suture is another surface marking. Now we come to the foramen magnum. The foramen magnum. So the brain stem runs through this and connects to the spinal cord. Foramen magnum. The foramen magnum. Occipital condyles. Remember, a condyle, these are condyles. They're smooth, rounded protrusions, and they usually rest on top of another bone. So they rest on another bone. The occipital condyles, these two, will rest on top of the first cervical vertebra called the atlas. So the occipital condyles rest on top of the atlas. So there are 7 cervical vertebrae, 7 of them. Okay. The first 7 vertebrae are called cervical. The first vertebra, cervical vertebra, is called the atlas. Okay. Oops. And this is it here. Okay. They're showing you the first 2 cervical vertebrae with this model. And what happens is that these condyles will rest right on top. Do you see these invaginations right here? Right here. They will rest right on top of these facets, okay? Like so. Okay, oops, my mistake. Right like this. See how these invaginate? And see how these groove down? They dip down to fit the condyles. Okay, and that enables us to move our head in the yes format. So the joint between the occipital condyles of the occipital bone and the first cervical vertebra enable us to move our head in this fashion, the yes format. Are you okay? However, the joint between, this is an aside because we're still just on the skull, the joint between the first and second cervical vertebra enable us to move our head in a no format because they create a pivot motion. We're going to get to that next time we meet for lab. That's the last exercise 13. Are you okay? I'd like to move on. External occipital protuberance. You know the little like bulge that you may see in some individuals who may have low hair or a bald head? You can feel this. This is the protuberance right here. External occipital protuberance. Okay. This serves as a point of attachment for some of the muscles in this area here, which you'll see later when we focus on muscle. External